Hey guys, I'm back again with another video, and this time it's a total ankle arthroplasty. This is a very complex, very complicated case. And as you can see, I tried to consolidate everything since I need as much space as I can for the rep trays and just to organize things so that we're not all confused of where things are when we're in the case. So times like this, when you don't have enough back table in the operating room, you just kind of have to figure it out. So I used the ring stand to put one of the trays, consolidated some of my instruments, and instead of getting the tray out, I kind of just took all the instruments out and then just lay them all out. When you're done, put them back. I have an extra mayo here, which I put the other tray over there, and I'm gonna free up this space once I gown and gloved everybody. And as you can see, there's a lot of people involved in this case. There's gonna be a the surgeon, then 3 podiatry residents, and then me. So plenty of people, plus x-ray, plus the nurse, plus the rep. So you kind of have to work with what you got. So everything in the rep trays here, I don't know the name, so I just kind of rearranged it with him and see what the surgeon wants and will use. As you can see, he got some trials over here, 1 and 2, that matches with the other trials, 1 and 2. That's our drill set. I'm kind of excited that they kind of put this tray over here to organize them instead of just being all messed up in a tray. It's kind of exciting for me. So I'm not gonna go over the rep trays because I have no idea what the names are. That's what the rep is for. He will tell you what you need and what you don't need. And so yeah, this is my setup over here. And again, this is not guaranteed. This is just based on what I know and what they used. So your orthopedic or podiatry surgeon might not use the same, but this is what I have so far. These fancy little things up here, that's from the rep trays. And this black thing and this and this. So the instruments that you would notice are the ones that are in a regular tray. So I have 2 15 blades, some Adson Browns, and with teeth, hemostat, Coker, Wheatlander, they like it dull. I have some osteotomes here. They vary in sizes, and so far that's what I have put in here. They kind of go from like 1 inch to bigger than that and bigger, and then up to 1/4, or yeah, smaller. And they also vary in the tips. It could be curved, it could be straight. And so far what I have here is, I believe, 1 straight and 1 curve for the 1/4. You have curettes over here, and I have more over here that are bigger on the tips. And that is a lamina spreader. I currently opened the small one, and I got a larger one in the room that is not open yet, just in case I need it. 2 laps. And as you can see, this isn't my normal setup. It varies, especially in orthopedic, and when you're trying to consolidate your space, you kind of have to minimize the little space that you have to maximize it, to provide space for the important stuff. So I usually have that red thing over here, but I don't. That's just me, just for space. And I usually have the trash over here, but because the residents move around a lot, they snag it, so I just put it on the side. Okay. And so the person who's going to be in charge of my table is basically just one of the residents, and I'm just here to guide them and make sure everybody is in compliance with sterile technique. And they have all their drapes over here. I have the extremity drape that the surgeon uses, and some half sheets and split sheets. This is a what you call this? I forgot. But it's like those Christmas socks thing, but it goes all the way up to your knees, and then they secure it with the S mark over there. Wait, that's an S mark. And then Coban, they wrap it. And I have all the lighting light handle over here, and that's a C-arm drape because there's going to be C-arm involved, and a stapler. So that's what I have. Okay, thank you guys for watching. I really appreciate your comments. Please like and subscribe and let me know how you would maximize your space over here if you really don't have a back table. This is as far as the best I can do, but if I had another table it would be better, but it is what it is.